But you look at Omicron and these numbers, and you think to yourself, this was anticipated by everybody. We knew we were going to see variants. We knew we would see other strains. At a certain point, when you look at, for example, the cruise industry saying you shouldn't even take a cruise now if you're vaccinated, I mean, are those kinds of measures necessary at this point? As you mentioned, the hospitalizations are not causing an alarm bell right now.
Well, I think the fear can be more paralyzing. When people get afraid, they actually forget not just quality of life, but they forget basic things. Like, I think people are so afraid of COVID that they also forget about their regular health checkups and other things that they need to do. In terms of the cruises, I mean, if people are very high risk of having severe illness, complications, if they have 3 or more risk factors, that's a different story. But for regular people, I think just being locked in and living like this, it has its effects too. It can take its toll in terms of depression, anxiety, all types of things. And then just the dreariness and the bleak outlook, I think that takes its toll on people as well, which we're seeing in studies. I mean, we can see that in terms of alcoholism, substance abuse, the opioid crisis has never been worse. The liver transplant rate from alcoholic hepatitis tripled last year. So you're seeing these effects in other forms, and I think we need to take that into account, which our focus has been on COVID, but it really hasn't looked at how this is affecting people's health and well-being in so many other ways.
I hear what you're saying, and I've spoken to so many people that I know, acquaintances who have been traveling, and they said, listen, I got my vaccine, I got my booster, it's time to live life. I'm not going to lock my child up and stay cooped up during the holiday period. If it happens, it happens. It'll run through our system and we'll move forward. And, speaking to the psychological impact, there's a lot to be said for that as well.
Yeah, I think also, for people, they need to see an end in sight. And if we look at history, not just COVID, if we look at history, viruses move forward towards an evolution where they do become more contagious. They become more contagious because they're trying to adapt and infect more people. But they also become less deadly over time because it doesn't help them to kill the host because they die at the same time.
Right.
So that's sort of the natural evolution. Here, I think the focus really needs to be on treatment. Like, what are we going to do for those people who do get hospitalized, for those people who are at risk, to protect them? Because there are monoclonal antibodies that work, but they're not out there. There are states that have severe shortages. So what's happening? Where is the supply chain being disrupted?
We've been talking about that for weeks. Where are the therapeutics? Where are the monoclonal antibodies? Where are the pills in mass? So that people are able to have access to them if they are infected, and then they can move on. That's the big question. Unfortunately, you and I can't answer it.